We want to keep our patients and community safe here.
And nurses at McLaren Bay say that's why they're fighting for a new contract. Lenita Brooks brings us to their rally today as they say the health of both patients and RNs is on the line.
Safe Staffing September is all about our patients and our community. We want to keep our patients and community safe here.
And that's why ICU nurse Lakin Gray, along with other McLaren Bay Hospital nurses, gathered today to highlight how RN staffing ratios help keep the community safe and healthy.
It just makes it very hard to be able to care for our patients properly. If you think about if you're pushing up to 7 patients a piece, you actually get 8 minutes once an hour with each one of your patients to be able to, take their loved ones to the bathroom, get their meds, be able to get all of their stuff, be able to chart on everything. That's 8 minutes is not a lot.
But the impact goes beyond the hospital room. Gray says the stress can also take a mental toll.
We're burnt out. It's hard to go to work sometimes. People have a lot of anxiety, PTSD, different things like that. People cry at work because they're so stressed.
All of this is in the midst of negotiations with McLaren to provide safer staffing levels and higher pay. Stacy Klump, Chief Nursing Officer for the hospital, says though they are working on a solution, their goals do align.
Which is to provide the very best safe patient care, and then making sure that we provide our nurses with the resources and tools to be able to provide that excellent care.
In the past 2 months, there have been 48 staffing emergencies reported in the McLaren RN unit.
We have a contractual process where we document when nurses are pulled from one unit to another, perhaps from an ICU to a progressive care unit. That did happen 48 times in the 2 months that they referenced. Overall of amount of occurrences, that actually happened 3% of the time.
She says they are continuously looking for ways to recruit more employees through various partnerships, including with colleges. For WNEM TV5, I'm Lenita Brooks.
Last month, Unite Here Local 24 workers at McLaren Bay rallied for a new contract seeking safe staffing levels and fair and competitive wages. After Lenita's interview, McLaren Bay sent us an additional statement saying in part, quote, staffing issues are a typical talking point used by union leadership throughout the healthcare industry to create a false narrative of unsafe patient care, unquote, adding it has safe nurse-to-patient staffing ratios to ensure it has appropriate staffing at the bedside.